everything that doctors say or everything that doctors know are totally just 100% true. And I think we have to understand that doctors are practicing medicine, and no doctor knows everything. That and so it's good when you can be able to kind of take situations into your own hand and maybe do what's best for yourself, and not just believe, I guess, one side of anything that somebody tells you. Of course, you can go on the internet and Google ozone in medical use to find out all the medicinal purposes that ozone is used. There are several different ways. There's insufflation, there's bagging it for limbs that may have gangrene or different things, or sores for diabetics. You can do what they call bagging it, and it will cause healing to happen pretty fast on areas that may be festered with sores or different things like that. You could do it in a spa. You could do it several different methods of administering ozone. They have a way of doing it where you take out so many cc's of blood and introduce the ozone into it, and then introduce that blood back into the body. Of course, this is one of the top ways of administering ozone at its most effectiveness. 130. Don't do this that often, but from time to time I will do it. For one, I'll do it to make sure I keep in touch with the practice of it, how to do it. Then also because it is a good immune booster. In other words, ozone can, for people that are without an immune system or immunity is very low, ozone can actually become an immune system for you. Of course, that type of person would need to do this protocol every day for a certain number of days in order to be successful at whatever you're trying to do. This is 130. Feeling a really good tightness in the chest here. So maybe I'll go to about 150 and call it a quits. Of course, I am doing a little bit faster than usual. I'm in a nice size vein, so I'm able to do that. Of course, and I understand it a little bit better than most people, so I would not recommend that anybody would introduce it into their body this fast, or I'm not even recommending that you do ozone. Do the research for yourself and make your own choices and your own decisions based on what you understand. I'm not suggesting or giving advice to anyone. 140. You do need a glass syringe. You cannot administer ozone in a plastic syringe. Also, for people that may have be fighting breast cancer, before I would let someone give me, I think it's cut into the breast or perhaps take it off, there are places that do administer ozone to the tumors that are in breast, and there's been reports all over the world and testimonies that those tumors liquefy when ozone is injected into them, which saves the breast. So that's just something maybe some of you might desire to check into. before having a mastectomy. I think that's the correct term. But as you can see, there are no basic side effects. The tightness in the chest or the fullness in the chest will allow you to understand that the body is being permeated and filling up with the ozone. That ozone is actually in your bloodstream. If you ever need to test the ozone, of course, once you become familiar with the smell, you know it. It's a very unique smell. But also, on top of that, you can always take a latex glove. And ozone, if it's present, it will dissolve that glove. Now, one of the reasons that I'm cutting off my lever, because I don't want the fumes of ozone to be escaping in the house. Because ozone is like an oxidizer. So if too much get into the lungs, it's just like Clorox. You know, it's like an oxidizer. It cleans things or oxidizes things. So too much can certainly, cause you to cough or something like that. So you want to do ozone in a well-ventilated place. This is 150. You want to do it in a well-ventilated place, where you have good ventilation. Sometimes when you're administering ozone, some of it can end up seeping into the tissue, which is not going to cause you any harm, just a little bit of swelling and a little bit of soreness the next day. But it's not a problem. There are some people that inject ozone into the muscles. So once again, it's not going to cause any major issues. That's going to hold 10 cc's right here. Look at that one got down. So what would this be? 160. Okay, minus 10. Give or take a few.